Hello nurses, how are you all, and welcome back to my channel Nurse Navigator Swati. I am back with the fifth part of Obstetrical and Gynecological Nursing MCQ question and answers. Quickly go through my Obstetrics and Gynecological question and answer series, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. Bandel's ring is, options are, it is a pathological retraction ring. Option 2, incoordinated uterine ring. Option 3, spastic lower segment, or option 4, all of the above. Bandel's ring or pathological retraction ring, it is a rare severe sign of obstructed labor where a visible palpable groove forms between a thickened contracting upper uterus and a stretched thin lower segment. So here option 1 is the correct answer. Question number 2. Which intrauterine device lasts for 10 years? Options are copper T 200B, Nova T, option 3 copper T 380A, or option 4 multi-load 250. Yes, you are absolutely right. Copper T 380A that lasts for 10 years, which is a non-hormonal copper bearing devices that is highly effective at preventing pregnancy. So here option 3 is the correct answer. Question number 3. The most common site of ligation in female sterilization is, options are ampullary, cornual, isthmus, or option 4 femoral. The most common site of ligation in female sterilization is the isthmus of the fallopian tube. This is the narrowest segment located between the ampulla and the uterus. So here option 3 is the correct answer. Next question. The snowstorm appearance of uterus in ultrasonography indicates the presence of, options are ectopic pregnancy, option 2 vesicular mole, option 3 fibroid in pregnancy, or option 4 conjoined twin. A snowstorm appearance in ultrasonography describes a chaotic bright and speckled ultrasound pattern, often indicating a complete hydiatriform mole or vesicular mole in obstetrics, where numerous hydropic villi fill the uterus. So here option 2 is the correct answer. Question number 5. Why a pregnant mother should lie on her left side when resting or sleeping in later stages of pregnancy? Options are to facilitate digestion, option 2 to facilitate bladder emptying, option 3 to avoid development of fetal anomalies, or option 4 to prevent compression of vena cava. Yes, you are absolutely right. A pregnant mother should lie on her left side to optimize blood flow to the placenta and fetus, enhancing nutrient and oxygen delivery. And this position prevents the heavy uterus from compressing the vena cava, that is a major vein on the right side, which can cause maternal dizziness and reduce fetal blood flow. So here option 4 is the correct answer. Question number 6. Maternal ketoacidosis is due to deficient intake of, options are carbohydrate, protein, fat, or option 4 vitamins. Yes, maternal ketoacidosis, which is often referred to as starvation ketoacidosis, it's primarily due to the deficient intake of carbohydrates. This occurs because pregnancy induces a state of accelerated starvation where limited glucose forces the body to metabolize fat rapidly, resulting in elevated ketone production. So option 1 is the correct answer. Next question. What is the most common major complication of retained fragments? Options are puerperal infection, option 2 postpartum depression, option 3 postpartum hemorrhage, or option 4 postpartum self-involution. Yes, the most common major complication of retained placental fragments after labor is primary or secondary postpartum hemorrhage. This heavy, often sudden bleeding occurs because the retained tissue prevents the uterus from contracting properly to seal off the blood, which is called uterine atony. So here option 3 is the correct answer. Question number 8. A client with painless vaginal bleeding has just been diagnosed as having a placenta previa. Which of the following procedure is usually performed to diagnose placenta previa? Options are amniocentesis, ultrasound, digital or speculum examination, or option 4 external fetal monitoring. Transvaginal ultrasound, that is TVS, is considered the gold standard and most accurate diagnostic measure for placenta previa, which will confirm the location, especially if bleeding occurs. So here option 2 is the correct answer. Question number 9. Ovulation is associated with sudden rise in, options are prolactin, testosterone, option 3 luteinizing hormone, or option 4 oxytocin. Ovulation is associated with a sudden surge in luteinizing hormone, which triggers the release of a mature egg from the ovary, typically around day 14 of a 28-day cycle. So here option 3 is the correct answer. Next question. In premature labor, which of the following medicines is useful for the newborn? Options are dexamethasone, option 2 magnesium sulfate, option 3 oxytocin, or option 4 testosterone. Yes, in premature labor, dexamethasone is useful for the newborn to accelerate fetal lung maturation, and it significantly reduces neonatal mortality, respiratory distress syndrome, and intraventricular hemorrhage by increasing surfactant production. So here option 1 is the correct answer. Question number 11. Pap smear is used for screening of which of the following? Options are ovarian cancer, cervical cancer, endometrial cancer, or option 4 breast cancer. Yes, pap smear, it is a crucial screening procedure that detects precancerous or cancerous cells on the cervix, that is the lower part of the uterus. So here option 2 is the correct answer. Next question. Meiosis occurs in human males in options are epididymis, option 2 vas deferens, option 3 seminiferous tubules, or option 4 seminal vesicles. Correct. Meiosis in human males occurs in the testes, specifically within the seminiferous tubules, and this process known as spermatogenesis involves the conversion of diploid germ cells into haploid sperm cells. So here option 3 is the correct answer. Question number 13. After birth of the baby, the fundus of the mother is about, options are 2.5 cm below the level of umbilicus, option 2 4.6 cm above the level of umbilicus, option 3 10 cm below the symphysis pubis, or option 4 none of the above. Immediately after birth of a baby and delivery of the placenta, the uterine fundus is typically firm and located roughly at the halfway between the symphysis pubis and the umbilicus. So approximately you can see 2.5 cm below the level of umbilicus. So here option 1 is the correct answer. Question number 14. Follicle stimulating hormone and luteinizing hormone are produced by, options are ovaries, placenta, hypothalamus, or option 4 anterior pituitary. Correct. Follicle stimulating hormone and the luteinizing hormone are secreted by gonadotrope cells in the anterior pituitary gland. So here option 4 is the correct answer. Next question. The outermost layer of fetal membrane is termed as, options are amnion, chorion, decidua, or option 4 placenta. Yes, you are absolutely right. The outermost fetal membrane is the chorion. It is a fibrous tissue layer that develops from the trophoblast and encircle the fetus, amnion, and yolk sac. So here option 2 is the correct answer. Next question. A pregnant client in late pregnancy is complaining of groin pain that seems worse on the right side. Which of the following is the most likely cause of it? Options are beginning of labor, option 2 it's a bladder infection, option 3 constipation, or option 4 it is because of tension on the round ligament. A groin pain in late pregnancy, it is commonly caused by the tension on the round ligament. It is a stabbing or dull aching pain in the lower abdomen or the groin area. It is mainly caused by the stretching and the thinning of the ligament which is supporting the growing uterus, and it triggered by sudden movements like coughing, sneezing, or changing the position. So here option 4 is the correct answer. Question number 17. The nurse is teaching exercises that are good for pregnant women, increasing tone and fitness and decreasing lower backache. Which of the following should the nurse exclude in the exercise program? Options are stand with the legs apart and touch hands to floor 3 times per day. Option 2 10 times of walking per day with an emphasis on good posture. Option 3 10 times of swimming or leg kicking in pool per day. Or option 4 pelvic rock exercise and squats 3 times a day. While giving a teaching exercise that are good for the pregnant woman, a nurse must include that she should go for a walking per day with an emphasis on good posture. 10 minutes of swimming is very effective, and pelvic rock exercise is also very effective for the fetal movement. But she will not stand with legs apart and touch hands to floor 3 times per day, as it risks of instability, back strain, and dizziness, particularly as the pregnancy progresses. So here option 1 is the correct answer. Next question. Which carries oxygenated blood from the placenta to the fetal circulation? Options are umbilical artery, umbilical vein, uterine artery, or option 4 uterine vein. Yes, you are absolutely right. Umbilical vein carries oxygenated blood from the placenta to the fetal circulation. So here option 2 is the correct answer. Question number 19. When augmenting labor with oxytocin, which of the following would be the priority assessment? Options are maternal vital signs, option 2 fetal heart rate, option 3 urinary output, or option 4 to check contraction characteristics. Yes, while augmenting labor with oxytocin, the priority assessment is to check the contraction characteristics that is crucial for safety and efficacy to prevent uterine hyperstimulation as well as prevent the fetal distress. So here option 4 is the correct answer. And the last question of this quiz session is, when a pregnant woman experiences leg cramps, the correct nursing intervention to relieve the muscle cramps is option 1, allow a woman to exercise. Option 2, let the woman walk for a while. Option 3, let the woman lie down and dorsiflex the foot towards the knees. Or option 4, ask the woman to raise her legs. When a pregnant woman experiences leg cramps, the best nursing intervention to relieve the muscle cramps is let the woman lie down and dorsiflex the foot towards the knees, which will immediately stress the contracted calf muscle and which relieves spasm pain. This action, along with elevating legs, aids blood circulation and reverses the cramp spasm. It is safe and most effective way to relieve common nocturnal calf cramps. So here option 3 is the correct answer. So let me know how much you have scored from this video and also mention me in the comment the topic on which you want more MCQs and explanations. See you soon in my next nursing quiz session.